Good morning, everybody. In today's lecture, we'll learn about very important antibiotic, which is metronidazole. Hope this session will be useful for the family students. So, moving towards the metronidazole, metronidazole is available in different formulations. That is metronidazole IV formulations, metronidazole tablet, and metronidazole gel. It is also available in metronidazole suppository. It is available most commonly available under the trade name or brand name Flagyl. So moving towards the properties of metronidazole. So the first property of metronidazole is that metronidazole is a synthetic drug. Metronidazole is a synthetic drug that it is prepared in vitro and it is not derived from any biological compound. And second point is that metronidazole is having a very small molecular weight. Metronidazole is having a very small molecular weight. Now this is very important. Since it is having a very small molecular weight, it readily dissolves into the biological membrane and it crosses the membrane and enters into the cell. As a result, when the metronidazole is given through the oral formulations, it is rapidly absorbed. And it is not only rapidly absorbed, but it is also efficiently absorbed. I repeat, it is not only rapidly absorbed, but it is also efficiently absorbed. And as it is a small molecular weight, it is since it is also given in an IV formulation, it also crosses the blood-brain barrier. And as it crosses the blood-brain barrier, so it is used in various conditions like brain abscesses. Brain abscesses. Okay. And the third important point about the metronidazole is that metronidazole is a prodrug. Metronidazole is a prodrug. What do I mean by prodrug? Like whenever metronidazole is used in IV or it is administered through oral routes or it is applied topically, okay, or it is applied topically, it is in its inactive states. It is in its inactive state and it is activated inside the biological system. So where exactly this metronidazole is activated? It is activated inside the susceptible organs. It is activated inside the susceptible organs. What are these susceptible organs? These susceptible organs are mainly anaerobic bacteria, anaerobic microbes, we can say anaerobic microbes. Metronidazole is activated mainly inside the anaerobic microbes. It is not activated inside our cells. It is not activated inside the aerobic microbes. It is only activated inside the anaerobic microbes. Metronidazole, having a small molecular weight, does diffuse into the normal cell, into the aerobic microbes, and into the anaerobic microbes, but it is only activated inside the anaerobic microbes. Now, what do I mean by anaerobic microbes? We will see in detail. So, anaerobic microbes, we have two types. Say we have the anaerobic bacteria and we have anaerobic protozoa. In anaerobic bacteria, we have certain classes. First class is we have obligatory or strict anaerobes. Strict anaerobes. So in obligatory or strict anaerobes, we have an example which is fusobacterium. Fusobacterium. This fusobacterium is responsible for causing liver abscesses, brain abscesses, and certain GI infections, gastrointestinal tract infections. Then another example in this is we have Bacteroides species. This Bacteroides species causes endocarditis and meningitis, right? And the third one we have, it is, keep it right here. Third one we have is Clostridium difficile. This Clostridium difficile causes diarrhea and mainly the inflammation of colon. So in a class 1, in obligatory or strict anaerobes, so we have the Fusobacterium, we have the Bacteroides species, and we have the Clostridium difficile. So the Fusobacterium causes liver abscesses, brain abscesses, GI infections. The Bacteroides species causes endocarditis, meningitis. The Clostridium difficile causes the diarrhea and certain colon infections. So it causes the abdominal pain. Okay, so all these three bacteria are rod-shaped bacteria. We'll see its structure here. That this so this is the Fusobacterium. It is a rod-shaped bacteria. Okay, this is the Bacteroides. It is having a bean shape. As you can see that it is having a bean shape. This is the Fusobacterium, which is the anaerobic bacteria, and this is Clostridium difficile. This is it. Okay, so this comes under anaerobic bacteria. Okay, this 3 comes under anaerobic bacteria, in which class, that is obligatory or strict anaerobes. Strict anaerobes. Then we move to the second class of the anaerobic bacteria, that is microaerophilic or facultative anaerobes. So in that we have Helicobacter pylori, which is responsible for causing the ulcers. Then we have the Gardnerella vaginalis, which is responsible for causing certain vaginal infections. Okay. So then we come to the anaerobic protozoa. So in anaerobic protozoa, we have 3 classes, or we have 3 examples. So the first is Giardia lamblia. Giardia lamblia causes diarrhea. Then second is Entamoeba histolytica. Now this is very important. Entamoeba histolytica. This causes mainly amoebiasis. Responsible for causes amoebiasis or dysentery or abscesses. And third we have is Trichomonas vaginalis. Third we have is Trichomonas vaginalis, that is responsible for causing certain vaginal infections. Now it becomes obvious that whatsoever these microorganism, that is anaerobic bacteria and anaerobic protozoa, whatever condition they are causing, that is either they are causing diarrhea, they are causing GI infections, they are causing amoebiasis, they are causing abscesses, metronidazole is effective against them. Metronidazole becomes effective and a choice of drug against such anaerobes. Now Why the metronidazole becomes activated inside only anaerobic bacteria? What is so special in the anaerobic bacteria, and why it is not activated inside our cells or the aerobic microbes? It does enter, metronidazole does enter into all three of them, or it is activated only inside the anaerobic bacteria. And after activation, what is the mechanism of action of metronidazole inside the cell? That we'll see in detail. So first we'll see about the chemical structure of the metronidazole. Okay. So chemically, metronidazole has an imidazole ring. Metronidazole has an imidazole ring. This is known as imidazole. Like suppose this is carbon number 1, 2, 3, 4, and 5. So at carbon number 1 and carbon number 3, it is having nitrogen. So this is called the imidazole ring. There is a very special thing about the carbon number 5. As carbon number 5 is having nitro group NO2. NO2. So chemically it is named as 5 nitro imidazole. And this entire thing is called metronidazole. Right? Now, just for the fun purpose, we'll see that suppose this is a metro, okay? Metro in which we travel, right? This is the metro, okay? This metro represents the imidazole ring. This upper part, okay? This upper part is the nitro group. This is the nitro group. This thing is the imidazole, this is the nitro group, and this entire thing is metronidazole. Now, this nitro group is known as electron gun. Why we call it so? This nitro group, we call it as an electron gun. We'll name it as an electron gun. Why? Because when this gun is loaded with an electron, or when this nitro group is loaded with an electron, this metronidazole becomes activated. This metronidazole, when this electron gun or when the nitro group is loaded with the electron, it becomes activated and forms a highly reactive species. As it forms a highly reactive species, it damages the DNA and the other cellular proteins. Okay? When it becomes highly reactive, it becomes like a reactive radical. Okay? And it damages the DNA and the cellular protein of the anaerobic microbes. Now, this electron, which is required for the activation of metronidazole, is also present in a normal cellular metabolism. These electrons are involved even in our own normal cellular metabolism, or these electrons which are required for the activation are also present in the aerobic microbes. So what is so special? What is so special in the anaerobic microbes that is responsible for this metronidazole activation? So we'll see this in detail. Okay, like suppose this is the cell membrane of, say, the Clostridium difficile, right? This is the cell membrane of the Clostridium difficile, okay? And there is metronidazole standing outside. Okay. This is the nitroglyph, and this is the metronidazole. This is the metronidazole structure. This is the cell membrane of the Clostridium difficile. Now, as discussed, it is having a small molecular weight. This metronidazole penetrates very easily from the extracellular into the intracellular environment. Okay. This metronidazole will diffuse from the extracellular environment to the intracellular environment. Now, this mechanism also occurs in a normal cell, in the aerobic and also in the anaerobic. Okay. Once the metronidazole is inside, what will happen? Hmm. Okay, so inside the cell there is energy metabolism going on. At least in this energy metabolism, the pyruvate is converted into the acetyl enzyme A. Okay, this pyruvate is converted into the acetyl coenzyme A. The pyruvate is a 3 carbon unit, and the acetyl coenzyme A is a 2 carbon unit. So this conversion happens in a presence of an enzyme. This conversion happens in a presence of the enzyme which converts a pyruvate into the acetyl coenzyme A and releases one electron. This electron is transferred into the electron carrying protein, which is peridoxin. Now, this is a very important protein. This is a special protein which is present only and only in the anaerobic microbes. This electron carrying protein is present only in the anaerobic microbes, which is peridoxin. So, this electron is loaded in the electron carrying protein, and this peridoxin becomes loaded with an electron. Okay. Now, moving towards a little basics, that is, in oxidation, there is a loss of electron. In reduction, there is a gain of electron. We can remember this as a oil rig, which means in oxidation there is a loss of electron, in reduction there is a gain of electrons. Okay, so here the pyruvate is being converted to the acetyl coenzyme A, is losing an electron, that is it is being oxidized, and this electron is being transferred to a special electron carrying protein peridoxin, which is present only in anaerobic bacteria or the protozoa, and this peridoxin receives an electron. So that means it is getting reduced. So this entire process, that is conversion of pyruvate to the acetyl coenzyme A and the transferring of the electron to the peridoxin and the reduction of the peridoxin, occurs through a special enzyme here, which is again present only in anaerobic bacteria and protozoa, which is known as P4. P4. What do I mean by P4? P4 stands for pyruvate, peridoxin, oxidoreductase. This is a very important enzyme. This enzyme is also present in only anaerobic bacteria and protozoa. So this enzyme is responsible for oxidating the pyruvate into acetyl coenzyme, transferring this electron to the peridoxin, which is a special electron carrying protein, and reducing this peridoxin and loading it with electrons. So this occurs with the help of a special enzyme, that is P4, that is pyruvate peridoxin oxidoreductase. So this is the speciality of the anaerobic microbes, that is the bacteria and the protozoa. Now, in our normal cellular mechanism, this process, that is the conversion of pyruvate to the acetyl coenzyme A, is carried out by PDH enzyme. PDH is pyruvate dehydrogenase. Pyruvate dehydrogenase. Okay, and this enzyme, what it does, it catches the electron in such a way that it is not snatched by the nitro group of the metronidazole. But in anaerobic bacteria, this ferridoxin is in such a form that the electron is readily snatched by the nitro group or the electron gun of the metronidazole. So what happens after receiving an electron? So this is, here this is receiving an electron, so it is going under reduction. It is going under reduction, so we can say that it is having reductive activation. It is having a reductive activation, right? So after receiving an electron, this nitro group becomes activated. So from the prodrug, that is from the inactive state, this metronidazole is converted to its active state. Okay, this metronidazole is converted to its active state. And what happens after converting into its active state? It will start firing. As its electron gun gets loaded with the electron gun is the nitro group. As this electron gun gets loaded with the electron, it will start firing. Okay, it will start firing and it will release three toxic compound. It will become highly reactive and it will release three toxic compound, which is the nitroso group. It will release a superoxide and it will release a hydroxyl radical. These all three are very, very toxic for the anaerobic microbes. Okay. Now, once it gets activated, okay, it is become fully charged. It is become charged. So now it is very difficult for the metronidazole to escape the anaerobic microbe. Once it is activated, it has turned into a dangerous molecule. It has turned into a dangerous compound. Why? When the electron gets loaded in the electron gun and it becomes activated. Where this electron comes from? From the ferridoxin. It is going through the reductive activation. It is getting activated. Okay. So when it is getting activated, the inactive metronidazole starts entering the cell and to maintain the concentration gradient. More entire reaction will keep on happening. The electron will keep on loading in the electron gun and the more and more inactive form of the metronidazole will be converted to its active form, and it will convert into a dangerous molecule which is not able to escape the biological membrane, as it is a charged molecule. So it will generate the ROS, that is reactive oxygen species. It will generate ROS, which are three toxic compounds, that is nitroso group, superoxide, and hydroxide. What this will do, these will directly affect the genetic material, which is the DNA. It will affect the DNA. It will uncoil the DNA. It will break the DNA. Okay, it will break the DNA. So what happens? The conversion of a DNA from the DNA, that is the replication, DNA replication is reduced. The conversion of DNA into RNA, that is transcription, is reduced. Okay, transcription is reduced or is impaired. Replication is impaired, and this reactive oxygen species also affect the cellular proteins. The cellular proteins. Okay, so these three will eventually lead to cell death of anaerobic microbe, that is either bacteria or protozoa. correct? That is, we can say that it is having a cidal effect. It is having a bactericidal, okay, bactericidal effect or the killing effect inside the anaerobic microbe, which is the bacteria and the protozoa. Now we'll go to metronidazole resistance. How the metronidazole resistance is produced. Now the good news is that the metronidazole resistance is very rare. It is very rare. And it occurs only in two microbes which are being found. These are Helicobacter pylori. The researchers have found that around 30% of Helicobacter pylori are resistant to metronidazole. And second is Trichomonas vaginalis, which is responsible for certain vaginal infections in females. So these two organisms, microorganisms, are resistant to metronidazole. Now, what is the mechanism of action of the resistance? How the resistance occur? So first is either the P4, the P4 enzyme, that is the pyruvate pyridoxine oxidoreductase enzyme, is reduced in concentration. This P4 enzyme is reduced in concentration. So what will happen? This entire thing, that is the transporting of the electron to the pyridoxine, which is the electrocarrying protein, and the snatching of the electron, or the sucking of the electron into the electron gun, will be impaired. Then the second mechanism of a resistance is there is an enzyme called lactate dehydrogenase. This enzyme increase in concentration. The entire reaction of the conversion of a pyruvate to the acetic acid will be done by the lactate dehydrogenase. And it will hold the electron in such a way that it won't be able to get transported here in the electron gun. So what will happen? Again, the metronidazole won't be able to get activated. It won't be reduced. Then the third mechanism of resistance is that yeah, the efflux of the drug is increased. That is, the metronidazole is very rapidly goes out of the cell, right? The efflux is increased. So these are the three mechanisms of resistance, that is either the P4, that is pyruvate pyridoxine oxidoreductase enzyme concentration is reduced, either the lactate dehydrogenase increase in a concentration, or the efflux of the drugs from the cell increases, right? Now, the metronidazole has a very important property. It is metronidazole is having a disulfiram like action. A disulfiram like action. Now, what is disulfiram? Disulfiram is used to treat the alcohol addiction. It is used to treat the alcohol addiction. Like normally, the ethanol is converted to acetaldehyde in a body. Acetaldehyde in a body. It is converted to acetaldehyde in a body by the enzyme known as alcohol dehydrogenase. Alcohol dehydrogenase. From ethanol, it is converted to acetaldehyde with the help of alcohol dehydrogenase. This acetaldehyde is very toxic. This acetaldehyde is very toxic. Okay? But the good news is This acetaldehyde is rapidly converted into acetic acid. It is rapidly converted into acetic acid with the help of enzyme aldehyde dehydrogenase. With the help of enzyme aldehyde dehydrogenase. But what metronidazole does? This metronidazole will inhibit this enzyme aldehyde dehydrogenase. So what happens? This acetaldehyde concentration in the body increases, which is very toxic. Which is very toxic. So this results in the dizziness. Okay, patient experiences dizziness, then headache, severe headache. Patient experiences abdominal distress and vomiting. Okay, this happens in a patient when he is on metronidazole and he consumes alcohol. Now, the similar action is produced by disulfiram. The similar action is produced by disulfiram. Disulfiram also inhibits the aldehyde dehydrogenase, increases the concentration of acetaldehyde, and it produces this toxic effect. Okay. Now moving towards the adverse effects of metronidazole. So what are the adverse effects of metronidazole? So in the GITE, it produces nausea, vomiting, epigastric distress, okay, mainly the abdominal pain. Okay, these are the GIT symptoms. It produces metallic taste. It produces the oral moniliasis. Oral moniliasis is a type of yeast infection in the mouth. And it also produces neurological adverse effect. In neurological, it produces dizziness, vertigo, seizures, peripheral neuropathy. Okay, so it becomes obvious that the patient having this neurological, that is mainly the seizures, vertigo, neuropathy, metronidazole is contraindicated in such a patient. If patients having seizures, vertigo, peripheral neuropathy, is having any sort of neurological disorder, the metronidazole is contraindicated in such a patient. Okay. So contraindications, of course, first is the neurological, that the patient is having any seizures, then the patients must be receiving phenytoin. And if the patient is having certain mood disorders and he is on mood stabilizers like lithium. So what this lithium and phenytoin does, it increases the concentration of metronidazole in the body, and it leads to toxicity. Okay, and it is contraindicated in the first trimester of a pregnancy. It is also contraindicated in a chronic alcoholics. Those who are chronic alcoholics, who are we cannot prescribe metronidazole as it is having disulfiram like action. And it cannot be used with certain anticoagulants like warfarin. Why? Because it potentiates its action. It inhibits the metabolism of warfarin. Inhibits the metabolism of warfarin. It cannot be used with certain anticoagulants, and its dosage should be reduced in a patients with a severe hepatic disease. Okay, it's if the patient is having hepatitis or having hepatomegaly or certain fatty liver. So in such conditions, the metronidazole dose should be reduced. So these are the uses of metronidazole. So as discussed, so it is used in the amoebiasis. It is used against the Giardiasis. It is used in trichomoniasis, that is bacterial vaginitis. It is used in the infection due to anaerobic bacteria. So its dose is like in children, it is given 45 mg per kg per day. In a 3 divided dose in adults, it is given as the 500 to 800 mg 5 times daily. In a geriatrics, the dose in children is 30 mg per kg once daily for 3 days, and in adults it is 2 gram once daily for 5 days. Okay, and in trichomoniasis, which causes the vaginal infections in female, okay, vaginal infections. So we can give 2 grams as a single dose. And infections due to anaerobic bacteria, which can be any infection, that is either git or abscesses or brain abscess, liver abscesses or brain abscesses, we can go for children, that is 30 mg per kg per day in 5 divided dose, and in adults it is 500 mg 3 times daily. And similar to metronidazole, we have other classes like tinidazole, secnidazole, onidazole, and cetronidazole. So these are having same mechanism of action. Same mechanism of action. It is given in oral IV formulations. Given in oral IV formulations. So these are also its main use is amoebiasis. It is trichomoniasis, and also in Giardiasis, it is given in sort of any GIT infection. These drugs can be given. In amoebiasis, it can again given in 2 gram once daily orally or for 3 days and 600 mg twice daily a week. In trichomoniasis and giardiasis, its dose is same, that is 2 grams stacked or 600 mg once daily for a week. And in anaerobic infections like the Helicobacter pylori infections, and as a prophylaxis therapy for the colorectal surgery. So this tinidazole can be used in that. Okay. Then we have the secnidazole, which is also a class, and it can be used as a single oral dose, that is 2 gram, is effective in a mild intestinal amoebiasis and giardiasis. Again, it is used in GIT, okay, and any GIT infections. Then we have the ornidazole, given in the oral or IV infusion. Okay, in amoebiasis, trichomoniasis, and giardiasis and anaerobic infections, and cetronidazole given oral in amoebiasis, trichomoniasis, giardiasis, and anaerobic infections. So this is all about metronidazole. Thank you.